All right, Michelle, we're going to dive into another one of these inquiry series. I'm so excited to talk to you about our second key talking point in the book that you bring up a lot, which is
It's healthcare coverage,
healthcare
and
coverage. Yes.
the whole big I called it healthcare coverage or not, because it's really about having coverage and not having coverage. It's about both.
Right. So, let's just talk about a second here. These are some of the things that you're experiencing in your own life from not having healthcare to then having healthcare. You're somebody who
That's
probably
right.
can really talk about understanding the divide between people who are what you call in the Substack article before this is warm and freezing, and that
Mhm.
people warm can't really understand people who are freezing. So can you help talk about this divide a bit? Like, how do you think it felt for you and your family to be in the freezing side of the healthcare divide?
Yeah. Well, when you don't have health care and you're doing everything, you don't have health care insurance. So you don't have health care because you can't afford it without insurance. And when you're in that situation, when we were in that situation, I mean, it felt crummy. It feels like you are always in a very risky place because if something happens to you or somebody you're responsible for, like your children, that you can't access what you need to keep everybody safe and as well as possible. And so
Or it'll wipe you out, right, Michelle? I mean, it could also like the
that's
people get
right. It
wiped
can
out
wipe you
by
out. It can take everything.
40 years
And
of Parkinson's is costly.
yeah. So the difficulty of that is that what I felt a lot was resentment. Why am I in this situation? I'm working constantly. And there's other situations where people are working constantly and can't make ends meet. So it's not it's not that I'm alone in it, but it's that people who didn't have that situation made big time assumptions like that Andy and I were just being stupid not to buy health insurance. And we were just being stubborn and these other types of ways of looking at it, when in fact that wasn't the case at all. And so it was really important to me to try to relate in this blog to people who really never have had insurance, because now I've been on both sides. I've have not had it and I have had it.
Because now you
And
have insurance with the VA, correct? I mean, isn't that like you got in the VA system too, which has been helpful, I think, in some ways, which is
having the
a lot.
VA come to become a possibility for our family changed everything. Where before that, we'd buy little bits and pieces. We'd buy, insurance for our daughter, accident insurance when she was doing ballet, because we didn't want her to fall and break something and have that incident wipe out our family financially. Um, and I just really feel that in both ways, like I felt completely out of the system and I felt completely misunderstood by anybody and everybody I talked to within the system, whether
What's
it was
interesting, Michelle, too,
a
is like,
doctor or a family member.
yeah, what's interesting is I'm hearing like you could feel probably very much like you're being looked down upon as somebody who's not worthy of having health or care or being healthy at all, I guess, because you didn't work hard enough for it, or you made some choice that wasn't, the right choice. So you didn't get to be included in the system. And the funny thing is coming from Europe, like over here now is
Yeah.
being included in that system. Cause I also, had a hard time paying for healthcare, true, in the United
Yeah.
States. And, here you just everyone has it, so it's very universal, and it's you definitely feel that the value and the importance of a human life is like, wow, you should never have to like pay debt your whole life if you get sick. What I be
Right.
punished twice? It's such a weird thing, and we have all the resources available to like,
Right.
take care of
And I
people.
think that the people who are in the system with their jobs or their work, or they make money and they make money fairly easily. I don't think that people necessarily are, I don't think it necessarily follows that it's the hardest working people that have the most money.
I
I
mean,
think
you're
that
born into wealth sometimes. I mean, you inherit
people
legacy
are born into wealth, or there's
legacy
all
wealth.
different ways
Yeah.
to have money. And then there's all different ways to not have money too. And so when you don't have money, to be shut out of a healthcare insurance system, it feels really, really, really bad. And I wanted to address that in this blog. And I also wanted to address that, you know, when you're shut out of something, you look kind of over at the grass is greener over on the other side.
Hmm.
And it's really easy also for it was easy for me to make wrong assumptions about the people that the haves, the people who had the health insurance and all the money, and it seemed like their lives were so easy. And
Yeah.
that was an assumption I made that was not always correct. And so I think that if we ever want to bridge this gap with communication, which may or may not be possible, but if we ever do want to bridge it with communication, it's going to have to go where both the people who are freezing and the people who are warm both look at the other side with an open mind and an open heart and try to hear what's going on with those people. Um,
Couldn't be better
because
message than for this time right now, Michelle, to unifying message. Thank you.
there's people who are like when I didn't have health insurance, I felt like a victim. I felt like I was living in a country that didn't offer something that I could afford that I really needed.
Well,
And
yeah,
when
yeah.
I talked to people who had health insurance at that time, they felt like people like me were just trying to sponge off of them and were
Mhm.
lazy and didn't want to, you know, didn't want to do what was needed to be done or sacrifice what was needed to be sacrificed in order to have this. And neither of those things were completely true. They both had some truth in them, but they were not true. So
Which goes to say there's sacrifices on both sides. And so
that's
I think,
right.
find the common ground is that we both,
Yeah.
healthcare is needed for every human being, right? We all brush our teeth, we all wipe our butts, like we all
Yeah.
take a shower. We all share health in common. So, I mean, it makes sense that we should find common ground on the sacrifices. Yes. So I think that's a really good thing. Can we talk a little bit about like system inclusivity? So like how being part of like the VA really brought a sense of dignity or respect to you that you
I
had.
imagine, but I don't know because I've never had healthcare in Europe where there's universal healthcare systems.
Okay.
And everybody is allowed into that system, regardless of who they are or how much money they have.
I mean,
Um,
Michelle, isn't it crazy? We have examples living. This is not like we have to reinvent the wheel. We have
right.
systems already within the world to take care of everyone.
Yep.
I just know that Americans just see it very differently because they want their optionality, of course, and you want the best of the best if you're making a lot of money. And the same thing happens here. They have private healthcare, so if you make a lot of money, you can still have a yacht. I always tell people, isn't it better if you just feed everybody first? Wouldn't you feel better?
Yes.
Everyone was fed a meal. Wouldn't you feel better on your yacht?
That's a
Sorry.
beautiful way of looking at it, Skylar.
And
That.
everybody who has a yacht wants everyone to be fed. They do. It's so true. We don't have to villainize these people, the haves. They bring a lot to the table, and I think they can bring a lot of transformation to the table if we get on the right conversation, which is what you're doing in the Substack. So,
That's what I'm trying to do. And when we became part of the VA healthcare system, it really suddenly we were part of something and we were welcomed. And, you know, the first part of our journey with the VA healthcare system, we paid co-pays for everything. Um, but it was according to our income. And they didn't like make you uh like when you went to the doctor, you didn't have to say, well, I'm in the poverty level, or I'm in the, super rich level, or I'm in the middle level. You just were cared for.
yeah.
And I remember my father telling me this is maybe a good story to end this discussion on because he was saying how the VA doctors um, were insured by the government. And so the VA doctors could earn a really good living without paying for malpractice insurance.
Yeah.
And that was a really cool thing because then they earned their salary and they didn't have to jam in more patients than they could handle in a day. They didn't have to keep the appointments to a certain amount of minutes, 15 minutes or 20 minutes. They had the ability to actually provide healthcare because they weren't bound by those restrictions that the insurance companies uh, make on the doctors.
Yeah.
So that's another thing that I found really, really interesting about the VA care is it's sort of like entering a little bit of a different land. You're kind of like, oh,
Which is
this
true.
is different.
The
Yeah.
people the people who served our great nation, and gave their
Yeah.
lives. should have all equal care. Of course, they've all equally gone into the force together, so that makes a lot of
Yeah.
sense. And we should.
And it's amazing when you go to the VA hospital, when we go to it in Albuquerque, which is regularly for Andy's different appointments, there's young, there's old, there's every color of person, there's female, male, there's tattooed, non-tattooed, there's, every kind of imaginable of person in humanity is represented. And that's
Yeah.
kind of neat too. It's kind of
I,
like everyone's respectful towards each other.
I want to leave a final thought just to build off of that, Michelle, and that is, I think that when people they take the Hippocratic oath, right, like to do no harm, I think it is, or
Yeah.
I think science and medicine never really saw dollar signs, really. Most people they want to just see cells and how to cure and heal and surgery and how to make the world a better place in helping humans, right?
Yeah.
So there's no profit involved in that. I mean, until of course you start paying for your bills, you need to make money. But um, I want to know also the diseases, they also don't see rich people or poor people. Diseases attack everyone. So we all share in common that medicine and science and, the diseases that we're discovering and trying to fight they don't really have anything to do with money. They really don't.
Right.
Of course they do
Right.
because the infrastructure of how do we deploy that. But in the beginning, those things don't really have anything to
That's
do
right.
with money. And of course, when COVID hit, we found a lot of money really quickly. So we're really good as human beings when we want to need to find the money for it.
Yeah.
Final thoughts
I
on that,
agree.
Michelle, before we close? Because this
No,
has
I
been,
think we've
I loved
said
it.
a really good some things to get people to think, and I'm hoping that maybe we get some comments on this
Love it.
conversation. See what's
Subscribe,
up.
like, share, comment, give us all of your feedback. We'd love to hear it.
Yeah.
Thank you so much
Please,
for being here.
please.
Yeah.
We're all learning. All right. Thank you.